Well, rare and complex epilepsy are rare by definition, and so it is very important to put together the expertise of different specialists to try to ensure that these patients have the best care as possible. And that's because, of course, we don't know that much about for example, the outcome of the disease over time. We don't know yet all the possible complications of these patients that also they may develop in the future. So it's very important to have input from different fields, and it's important to also think how to prevent possible complication. And so this kind of multimodal, multi-level approach is becoming more and more important in the management of these patients. That depends on the condition. So one starting point is the specific diagnosis. They usually have a genetic diagnosis. So one should start thinking about what that genetic diagnosis involves in terms of multi-organ involvement, and then based on that, input for different specialties, let's say neurology, but also cardiology, orthopedics, and gastrointestinal problems, for example. So all those different inputs are needed. And also, I think we need to consider transition. So, for example, pediatric care sometimes may differ from adult care, and so, of course, pediatrician may be involved at the disease onset, but then kind of more orthopedics, physiotherapy, and geriatric input also will be required. So it depends on the specific disease, but also on the age of the patient and the transition plan. Well, by definition, personalized medicine is not about genetic only, but is all about really a kind of holistic view of the patient. So that includes, of course, patient lifestyle, environment, social circumstances. So it should really go more and more towards a holistic view. And so genetic is a starting point. Then one should go into the more kind of specific patient-centered aspect.